In today's world, people tend to take diabetes for granted and just forget about it because so many people they know, or maybe they themselves have it. And although it's very manageable, a disease that can be as destructive as diabetes deserves more attention and a little bit more serious consideration. Our guest today is a nurse educator from Perry who normally educates on diabetes, and today is going to be clearing up some myths and sharing about the latest discoveries that they've made about what diabetes can do to the body. Before we get started with the episode, remember you can always find out more information, read about our guest, and access resources, even access old podcasts and blogs if you go to www.perrymemorial.org/pulse. Thanks for tuning into the Perry Health Pulse. Let's get to the episode. Our guest today is Candis Albrecht. She works in Perry's ambulatory care department, is actually the diabetic nurse educator, and has been a nurse for 14 years. Thanks for joining us, Candis.
Thank you for having me today, Dane.
Today we're talking about diabetes, which falls perfectly into your range of what you deal with and what you educate people on. Can we start with just a brief background of the biology of it? What is diabetes? How does it happen? What's it do to the body?
Diabetes is very complicated because it doesn't just affect one organ. I attended a conference last fall with a pharmacist, and she broke it down into all 11 organs in the body that are affected. The best way I describe diabetes to my patients that come in is I describe it as a utilization problem. You have a problem utilizing your sugar, you have a problem utilizing your insulin. And those two things, if we can correct those in my type 2s, that you can live a more balanced life. Big misconception about the biology of diabetes is I hear sugar diabetes or sugar glucose, however you want to refer that to. That's just a tip of the iceberg. A big false thought in diabetes is my pancreas doesn't work. A lot of times people have enough insulin to allow your body to function properly, but it's a utilization problem. Is it not getting into the cells? Is my pancreas not producing enough? So it's a utilization problem. We need to find out on your care team, do we need to add medications? Do we need to have a weight reduction? How can we utilize your insulin and utilize your pancreas? This is exactly what I tell my patients. I tell them that your cells are the powerhouse in your body. Your cells need fuel like your car. And in order for that fuel to get into your cells, you need a key. So when you start your car, you need to turn the engine on. Your key is insulin. If you do not have that insulin key to turn on, your body can't use that glucose. That glucose stays suspended in your bloodstream. That is where you see the high glucose readings in your urine and in your blood. So the target is to balance that out. You should have adequate sugar going in and adequate insulin to allow that to happen. It's a very exciting era we live in with diabetes because now we have numerous medications that are able to help with all those 11 broken systems and broken areas of the disease process.
So I've seen before if somebody has too little sugar in their system can lead to passing out, right? Now, when it's too high, that's a little harder to know that you have too high a sugar in your system.
Yes, you are correct. Low blood sugar, which is called hypoglycemia, usually people can pick up on that very fast because that occurs very fast. High blood sugar, usually, unless you're a type 1 diabetic, doesn't rise as fast, so your body has a chance to compensate. So it's just the basic, the faster something falls, the more you're going to feel it versus it's that mechanism. So when your sugars go low, they go low very, very fast. And that is a lack of carbohydrates. Again, that could be due to numerous reasons. One thing that shocked me as I got into diabetes was I always thought low blood sugar, I didn't realize it was as much of a medical emergency and can cause complications as well. Because all we talk about is high blood sugar and the chronic complications. We don't talk about the low blood sugars. Those are just as bad for your cardiovascular system. And they also, studies have showed that you can have increased risk of heart problems and stroke with low blood sugars. Low blood sugars tend to be able to be corrected very, very quickly with a carbohydrate replacement. But I do caution people they need to be aware of when it happens because it can lead to a medical emergency. You can go into a coma without rapid intervention and it can lead to death. So I tell my patients to be aware of the hypoglycemia. Be aware, I'm shaky, I got that. A lot of times they tell me they have a black feeling behind their head. Their vision is blurry. Those are things where I tell people get rapid glucose in now. I don't even encourage my patients to check their finger. Yes, I want to know where they're at. But if it requires you going upstairs to your bathroom to get your glucometer, you just wasted a bunch of time. So if you can check your sugar, great. But the biggest thing is correcting. I encourage especially my insulin because people who have to give themselves insulin injections are at higher risk of hypoglycemia because that's the number one complication of insulin. So those patients, I always encourage them to have a rapid form of glucose. You can buy commercial made products such as glucose tabs or gel, or you can just keep simple hard candies or even a little can of soda for my patients that are symptomatic. My last thing on low blood sugar is you just because you drink a cola or you drink some juice or you put some glucose tabs in your mouth, you run the risk of being low again in 15 or 20 minutes. So those patients need to eat a meal. So that's another part of the low blood sugar management is they need to get adequate carbohydrates and adequate protein in. You can't just quickly fix it. I also tell them that they need to meet with their provider and let them know exactly how many episodes because they may need to adjust their medications as well that lead to that problem.
So when when sugar levels are too low or too high for too long or too often, it keeps happening over and over again, what type of damage can that do to the body over time?
Very good question. It's the more highs and lows that you have, it becomes harder on the cardiovascular system. We all know that prolonged hyper, which is high blood sugar, causes cardiovascular damage. We are just now finding out the damages that are occurring when you go high, low, high, low. I just read a study last week on cardiac mortality and morbidity regarding going from super low to super high. It's all about a compensation. I think we're going to find more research. I think we're going to pay more attention. Right now, it's just really hard for people to catch their highs and catch their lows unless they physically know how they feel. Currently, certain insurance companies and certain patients meet criteria for what's called continuous glucose monitoring. And that is truly the wave of the future. That is watching your glucose all the time through a particular device. I think as we see that become more mainstream, that we're going to see the people with the highs and see the people with the low, and we're going to really make that correlation on cardiovascular complications. Right now, we're just not getting to that focus on our care with our patients right now. So we're still relying on the finger sticks. Also, hypoglycemia is very individualized. As being an ER nurse in the past, I've seen somebody walking around with a sugar of 30. I've seen somebody with a sugar of 150 and they're hypoglycemic. So it's very individualized as well. And I think that plays a huge role. Some of my older clients, they do not handle low blood sugars at all. So again, I think you're going to see it be very individualized. And I think you're going to see more of the continuous glucose monitoring as a better indicator on where and how your sugars fluctuate.
Well, that's great. That really seems to tie into where healthcare is going. So that's great to see. And hopefully more insurance start putting that out there and covering it. Let's pause for just a moment and hear from the sponsor of today's episode.
Get the health you've been dreaming of. 1/3 of your time is spent sleeping, and sleep restores your brain. Sleep apnea is a serious disease, increasing the risk of heart disease, stroke, high blood pressure, and more. What's the difference between a sleep lab study and a home sleep study? Let's talk. Call me, Tim Schultz, Director of Perry Sleep Center, at 815-876-2492.
Now, I've heard before that if someone doesn't manage their levels very well, that it can affect their mental conditions. Can you speak to that at all?
When I teach my patients the highs and lows of blood sugars, you'll see a lot of them alike. They can be shaky, they can be irritable. A lot of the highs and lows will correlate with your readings. I also recently read a study through the American Journal of Medicine that said that there is a correlation with dementia and cognitive decline with elevated sugars, there's a particular peptide that's released, and they're finding out that ups your risk for dementia and cognitive related issues as you continue to have the high blood sugars. Same thing with the low blood sugars. Your brain needs glucose to work, and this is where I tell my patients why it's important about balanced diet. I know there's a lot of fad diets out here. What patients have to understand is your brain functions on glucose. You must maintain an adequate amount. Anytime you're robbing the brain of glucose can lead to cognitive issues. Again, technology, I think we're going to see more awareness on the highs and the lows, but this particular study was very interested on this particular peptide seemed to be elevated, putting you at a higher risk for dementia and cognitive issues. Also, we know that high blood sugar ruins the blood vessels, so you're damaging the blood vessels of the brain too. There's just not a vessel that isn't affected by prolonged high blood sugars.
So if you could give one recommendation, something that people can do to help manage their diabetes better and avoid complications, what would that be?
My number one recommendation would be to see your provider. See your healthcare provider. Talk openly and honestly about your diabetes. My second recommendation that goes with that is ask to see a dietitian, ask to see a nurse educator, ask to see somebody. Your provider gets a limited amount of time with you, and that's normal. And he or she has many things that you need to cover. You can't cover diabetes in an hour. You can't cover it in 2. You need to meet with somebody regularly. You need to talk to somebody who specializes in those areas that you may struggle with. So I tell people, ask to see an educator, ask to see a dietitian.
How often would you recommend seeing the provider? Some people do it once a year. Would you recommend more than that?
Obviously, I would definitely recommend more than that. It does break down to what your insurance covers, a minimum of a year. But there's so many blood tests and so many supplemental tests that come with your management. If you are somebody who has very good glucose control, you might be able to get away with a 6-month visit. I recommend, I've got a patient now, it's on like a 6-week. I got patients that are checking in weekly. There is no standard recommendation, but if you continue to have high glucose readings or low glucose readings, you go in and see that doctor as frequently as you need to.
Are there any online resources you'd recommend for people with diabetes?
The best resource that I have found to be most helpful when I refer patients to external sources, I like the American Diabetic Association. I've been to numerous conferences of them. I think they're more patient-friendly than some of the resources out there. They have recipes, they have magazines, they have just so many resources out there. Like when I'm on the website, I click on this link and it takes me here and takes me there. They organize, diabetes walks. They have a lot of resources for the patient. Sometimes I think in healthcare, we have resources that are more tailored towards the professional aspect. I think the American Diabetic Association does a very good job of working with providers and patients on a level everybody can understand.
I think you've done a fantastic job clearing up some information that people don't, or they make assumptions, like you said, about, the pancreas just doesn't work, or it's just the high blood sugar can cause problems and things like that. And we're addressing this on a limited scale, but that's great information to share. How else could they learn from you or get in touch to get more information?
Back to my favorite response, talk to your provider. We are moving to a patient-centered healthcare, and you need to be your own advocate. You need to tell your doctor, I want to see my diabetic nurse educator. I want to see my dietitian. You can meet with them as often as needed because, again, one session with your doctor and one session with a resource is not going to be enough. Diabetes is a comprehensive disease. As I said before, it affects numerous organs. And I don't think it gets enough attention and enough time. So ask your physician for a referral to a diabetic educator and dietitian, and they will continue to follow up with you anytime you have changes in your medication regimen or you see your sugars going back up or your sugars going down. Ask, be your advocate. Tell them you want a referral to a diabetic nurse or a dietitian.
Thanks very much for joining us, Candis.
Thank you.
All right, you got to hear some great recommendation about diabetes and what to do next. Set up that meeting with your provider and try and get in to see more specialized care and get onto the pathway to a long and healthy lifestyle. That's what we want you to do, is be preventative, be proactive. Don't let things get down the line to where it's too late to do anything or it's going to be a long and tough road ahead. We want you to be proactive about that. So listen to Candis's recommendations. Again, you can learn more by visiting www.perrymemorial.org/pulse. You can also submit recommendations for future episodes, topics you want to see, and leave feedback. We'd love to hear from you. Thanks for tuning into The Pulse.